So today, our program is just like the presentation of the lean canvas in each group. If anyone, if each group is available or ready, so you can start one by one. Which group is ready?
So good afternoon, everybody. Today I am going to present the lean canvas that my team has prepared. And our topic is the problem that we are going to solve in the lean canvas is the high downtime of medical equipment. As we all know, the lean canvas is a one-page template which serves as a dynamic tool for brainstorming, refining, and communicating business ideas. So I am going to present the different aspects, the different sections of our lean canvas. The first is the main problems. The high downtime of medical equipment, which affects the medical staff and the patient, which leads in delay in patient care. And we also have the problem of increased cost of maintenance. So the customer segments that will benefit from the solution that we are proposing are patients and the healthcare providers. And our unique value proposition is minimizing equipment downtime and then ensuring uninterrupted and safe patient care, which will also have cost-saving benefits. And our solution is that we are proposing as follows. We wish to create a maintenance system which uses predictive analytics to detect problems in advance so that we can prevent sudden failures of equipment. And then we can form a responsive service team by using a data-driven CM, computerized maintenance management system. And to form this team, we can also offer comprehensive and extensive training programs to our technical staff to resolve problems quickly. And the channels that we are going to use to formulate the solutions are collaboration across government health departments so that we can share resources, and then engagement with other hospital departments such as the administration and the procurement departments, and also by participating in healthcare conferences and international seminars. And the cost that is involved in our solution proposal is staff salaries for the technicians, and then cost for implementing the predictive analytics system, and then also operational expenses since we have to maintain our repair facilities and have up-to-date diagnostic equipment. And the revenue streams from where we are going to earn to implement this project, we can have it from government funding, grants and aids, and also fees and charges from the customers. The key metrics how we are going to measure the successfulness of our project is equipment uptime percentage, the mean time between failures, and also how much cost we have saved by reducing the downtime of equipment, and also our customer satisfaction, the positive feedback that we receive from our customers. And then our unfair advantage, the advantage that we will have over others is we will have a dedicated, skilled technical staff and proprietary predictive maintenance technology. And the existing alternatives that exist right now to solve this problem is substitute equipment in case there's breakdown of the main equipment, and also outsourcing of services to private clinics, which cost more money. It involves more cost. Therefore, to conclude, the implementation of a lean canvas to address the problem of downtime of equipment, delay in patient care, and increased maintenance maintenance cost is achievable. By making use of technology, we can focus on value creation and improve patient care. Thank you for your attention.
So have you finished?
Yes, ma'am.
Okay. Thank you very much for your presentation, and we see
Thank you.
very clear about your lean canvas. But however, we have some questions. Okay.
Yeah.
So for the project that you take a look to decrease the downtime of the equipment, it means that all of the medical device equipment, right?
Yes.
Okay. You're not only specific on some like high risk, medium risk, or low risk. So uh every types. Am I right?
We may to see if the project will be successful, we may start with a certain category of equipment and then move on to different categories later on. Maybe start with the high risk one, critical ones.
Okay. So that's why in the case if you want to focus on the high risk, so just like make it clear, okay?
Okay.
Can
Yeah.
scope. So you can scope your topic and your development
Okay.
outcome.
So we'll add it to the canvas later.
How much of the downtime nowadays? Do you have any information about that?
Actually,
Approximately.
it depends on the availability of spare parts, on the delivery of spare parts, and also the technical support that we receive from the representatives of the equipment. So there are times when it can take months to get an equipment repaired.
Okay, so it depends, but we
Yeah.
can see that the technology that you can develop, I think that is very interesting. It's just like the prediction,
Yeah.
of the medical
The
device
prediction,
downtime.
yeah, we will come to know in advance if we need to replace a part or repair
Yeah.
a part, so that we will not have sudden failures, sudden breakdowns.
So nowadays, in your country,
Yeah.
based on the outsource, right?
Yeah, for example,
Outsourcing
if we
source.
have an MRI machine which is not working, we
Uh.
will send the patients to the private clinics to have their examinations.
Okay.
Yeah. And certain small equipment like the ultrasound machine, the representative can give us a backup machine until the main machine is repaired.
Okay. And Ajahn Anuchit has the question about the customer segments, because the
Yes.
customer segments right now you define of the patients and also the healthcare provider. Okay, we have no
Yes.
questions about the healthcare provider, but for
Yes.
the customer segment, because if you want to develop the system,
Yes.
this is effect to the patients. In our opinion, it must be only effect for the BME roles.
Okay. So I think it is the healthcare staff who will be mainly the
Yeah,
customer.
something like
But
that.
I thought at the end we are giving the service to the patients, so they also indirectly become our customers.
Indirect
That was
effect.
the idea. Yes.
Yeah, but indirect effect, it gonna be the patients, of course, but however, the
Yeah.
direct effect must be effect
The
on
the hospital staff.
the staff. Yes.
Yes.
Okay, I thinking in these customer segments in the patient is if your systems can use for the home care service, some things is maybe have in the customer segment in the
Yes.
future.
Yeah,
Okay.
in
But
the
right now, I
future,
think
yes.
that you want to develop the system only for the hospital
For the
or only for the
hospital, yeah,
BNE staff. So the customer
yes,
segment must be only the BNE staff.
okay,
However, as Ajahn Anuchit mentioned, in the case if your system gonna comply to the home care, okay, it will
yeah,
affect to the patients.
okay, yes,
Okay,
sure.
yeah. So any comments? Any more comments?
Okay, I have in the solutions, you
Yes,
have the 3 solutions, right?
yes,
The first is a create maintenance system with the predictive analytics. This, if you
yes,
are in this course, in the predictive analytics, you will learn in the artificial intelligence and the big data in this
yeah,
course, and have a little bit of the practice for you. Okay, I think it's
yes,
a good knowledge for the apply in this one. And for the second, you're performing for the responsive service team for the using data diving in the computer line maintenance management system. This one is we have the session in the CMMS in this session, and a little bit for the practice in the this of the management of the medical device with the medical device life circles. Okay, I think,
okay.
and now what is you have the first priority for the solution you want to develop in the three solution. What is
Because we want to continue from your lean canvas. We want you to pick up
Okay.
one of the solution and develop the things after you finish the course, so you can have like the mini project about that. But right now you have the 3 solutions. Which one that you think
Yes.
is the highest prioritized that you want
I
to
think the first one, I am looking forward to the first one,
the first one,
predictive
right? To
analytics.
create.
Yeah.
So maybe the project, the topic of your project is really clear right now, that you want to create the maintenance service with the predictive analysis. Yes.
Yeah. I would like to know how to implement that solution, how to start it.
Yeah, for this the solutions, that mean when you are finished in the lean canvas already, I have the practice 3 for the smart health category and practice for the CMMS. For the smart health category, we have the assignment for you for the design on these solutions. Okay, and before you decide this solution, we have the invite speaker for
AI.
lecture you in the
AI and big data
and big
analysis. So
okay.
you can your
Yes.
knowledge on that, and you can adopt the basic knowledge
Yes.
from the speakers and think about how to create the maintenance service with the predictive system. Yes. Yes. Okay. Another question
Okay.
from the
I'm looking
stage.
forward to it.
Yeah. We want to know that what is the ratio about the medical device per one staff that you need to taking care? Do you have the ratio about that?
I don't have a ratio, but for my region, we have about 700 equipment, including minor and major equipment for my region, with 4 technicians and myself.
Okay. Okay. This is in Mauritius, right?
This is for one region in Mauritius. Yes.
Okay, region in Mauritius. And how about in another country? Do you have any data from Pakistan, the member of your group?
No, maybe they can reply if they are online.
I'm not sure that normally
Okay,
Miss Nabila always here. I'm not sure that she's here or not, so she can give us the information about Pakistan.
Nabila, are you there?
Okay, it's fine. It's okay. So later on, maybe we ask more information about the your background. Okay.
Yeah.
But okay, this is a very good one for the practice of this group. So we would want to give the greeting and applause for you. Very good job.
Thank you.
Yeah,
Thank you very
very good
much.
job, and it's pretty clear for your idea. So you can
Yeah,
see that
thank you,
after you
ma'am,
work
for
on,
suggesting the
yeah,
idea. You
uh-huh,
suggested the idea. Yeah.
okay. So with this idea, so you can see pretty clear about the from the SWOT and from the lean canvas. So you have like very clear idea what do you want to solve the problem and what you are going to reach for the technology development. Thank you very
Yes.
much. Thank you
Thank
very
you very
much
much.
for the group number 2.
Thank you.
Okay. We got the hands up. Okay. Clap. Applause. Okay. Okay. So, which group is ready? Which group is ready now? Which group is ready? Because today is the day that you need to present your assignment. And we do hope that all of you are ready. Bhutan.
Yes, we'd like to present the 5th group.
Okay. Yes. Go ahead. You can share your slides.
Is my slide visible, madam?
See. The screening showing. Okay. It's okay.
Hello. Greetings to everyone. This is 5th group, Bhutan 1, and our topic was like introduction of telemedicines in remote areas, remote part in Bhutan. As you all know, the telemedicine refers to the provision of remote clinical services via real-time two-way communication between the patients and healthcare providers. And I have like extracted 3 weaknesses and threats from our SWOT analysis. And the problems are like cybersecurity risks. Second one is lack of clear regulation and policies governing telemedicines in Bhutan. Currently, apparently, there is no such policies regarding telemedicines. And third one is like high initial investment required for setting up. And after several discussion among us, we thought like, the best solution would be like using robust firewall, giving trainings and creating awareness among the clinicians, users, and frequent software updates would be the best solution to mitigate the cybersecurity risks. And second one, since in our country there is no regulation, developing a regulations and policies in collaboration with relevant stakeholders would be the best option to resolve the issue of lacking the policies. And the third one, we thought like securing fund, 100% securing the fund through Ministry of Health, because the health services are related with Ministry of Health, and UN agencies such as WHO and UNDP would be like best choices for us to like resolve these investment issues. And the key metrics, to measure those above solution would be like first performing a risk assessment for choosing the best using the robust firewall and all. If we perform a risk assessment, and based on the assessment, if we could develop it to like guarantee the security of patient data and privacy. And second one, like in order to measure where the policies or regulation is practical or impractical, it would be better if we could measure the percentage of patient diagnosed safely in remote areas in line with the established policies and regulations. And for third one, we thought like, after generating a bill of quantities of the equipment that would be required in establishing the telemedicines in remote area would be the basis to propose the fund to the higher agency. And the unique value prop would be like secured patient data in their privacy, and legal and regulatory compliance established with this. And with the proposal to higher authority and Ministry of Health, we are ensuring the budget, investment budget to be secured. And the high level concept we're working on would be like telemedicine platforms have revolutionized the way healthcare services are delivered, providing unprecedented accessibility and convenience to patients and healthcare providers alike. And the unfair advantage after this introduction of this platform would be that the advent of this platform would propel healthcare into a new era of patient monitoring via securely interconnected devices, and on-time healthcare services would be delivered. And the channel would be like through Ministry of Health, UN Agency for the Funds, hospitals in remote areas. Execution will mainly take place in the remote areas in Bhutan, and the field visit to nearby hospitals, those who are practicing, telemedicine already would be a great help in establishing the telemedicine in our country. And the customer segment in this case would be like patients and clinicians in remote areas during the introduction phase. And for the cost structure, there would be like cost for the procurement of ICT equipment required in like introducing telemedicines, for example, for laptops, mobile phones, Wi-Fi and internet packages charges. There would be a cost, and then the fund for training for users and clinicians, and revenue streams would be like government funding, grants and aids. Thank you, Madam. Hello?
Okay. Hello. Thank you very much for your presentation. So this group is pretty clear about the technology that you want to develop about the telemedicine, right?
Yes,
So
ma'am.
the problem is the security risk. So that's why the solution that I think is more clear about your topic for the development is the telemedicine with the cyber security. Am I right? That's the thing that you want to develop, right?
Yes, ma'am. Yes.
So maybe the solution, you can make it clearer, like the topic of the development of the telemedicine with cyber security, and maybe you add it up with comply with the standard. But I have the questions that in your country, do you have any standard about the telemedicine or not?
Apparently, there is no
The
standards
standard
regarding.
requirement. Yeah.
Yes,
So
ma'am.
you need to take a look, which is
Yeah.
the international standard about the cyber security,
Yes,
maybe
ma'am.
about the PDPA or comply with the ISO 27791, and you just take a look on the standard and take a look on the standard requirement. Then you can develop the system comply with the standards. So it
Sure,
will be
madam.
good. Yes. This is our recommendation.
Okay,
Are
thank
you
you,
clear
ma'am.
about that?
Yes, madam.
Okay, for my as why I think I will send some of the document when you want to develop of the telemedicine to you about the ISO 27799, and I have the document for the WHO ITU global standard for accessibility of the telehealth service. This, I think, this is useful for you when you want to develop this one.
Thank you, sir. Noted lah.
Circulate the document in the WhatsApp group. So maybe another group can use this document also.
Yeah,
So I
that
think
would be very much thankful, madam.
you're welcome. So Ajahn Anuchit gonna send that document. So after this, I think that for the Bhutan One team, you just take a look on the requirement of the cybersecurity standards, and then you can design for the system that comply with the standard. It will be the best thing, because if you develop the system without the standard, when one day, okay, the standard is pop up and you need to remake this the system again, so it's waste of the time. So just follow the standard and comply everything with the standards. Okay.
Okay.
Thank you very much. Thank you very much for the group Bhutan number 1. Okay, this is a good job also, and pretty clear
Thank
about the
you.
technology that you want to develop. Thank you very much.
Thank you.
Okay, the third one who is ready. The third one who is ready. GMMR, are you here? GMMR group, are you here? Uh-huh. If you want our consultant, you can just like, send the questions in the WhatsApp. Always don't be hesitate. So we can guide you in a case if you are not sure what to start, and maybe sometimes you are not sure that, okay, what you did is right or wrong. So we can give the comment. Which group? Okay. Okay, you hands on. So you, Mr. Harumushika Kisa. Okay. So you can turn on the microphone, unmute it.
Hello, everyone.
Hi.
Hi, do you hear me?
Hi. Yes.
Hi, do you
Oh.
hear me?
Yeah, we can hear you. This is your group?
Yes,
Okay.
it is about medical equipment management. We tried to focus about 3 problems. The first was about a long procurement process, and the second was about infrastructure that are old and lack of modern technology. And the third one was about shortage of biomedical engineer during procurement process. And we tried to focus about 3 solution. That was the first, to develop the centralized procurement system, and then to develop an understandable strategic plan to upgrade health infrastructure, and then a third solution for offering a course at biomedical engineer courses at local university. And then there was also about some existing alternatives for trying to solve those problems. It was, for example, to try to supply directly to the manufacturer in the factory. And also there are some solutions for about long-term investment during the budget of our hospital. There are also some training about supply chain management for all the participants in the procurement, in supplying, to understand what is the job of each one in order to do good procurement of medical equipment. There was also the most important things was about the target customer, who are hospital and clinics, who are medical equipment supplier, also some graduate engineers that are involved during the process of procurement. And about the key metrics, we have procurement period reduction, we have upgrade health infrastructure and technology, and we have also biomed placement rate in medical facilities. They are highest level concepts that are, for example, public health facilities and quality control and evaluation that are done every trimester or semester and every year to control the quality of health system and health facilities. The channel that was targeted are healthcare and engineering conferences, and also there are some public and private partnership that can help to to do all those procurement system. And in early adopters, there are tourists about healthcare providers and medical equipment manufacturer, and also supplying company that help to take the equipment from a manufacturer and then distribute in a different hospital and healthcare centers. And about to the cost structure. The cost structure, can slide down. About the cost structure, you have the cost to upgrade healthcare infrastructures and technology. We have also the cost of training biomedical engineers, and also we have administrative and operational costs. About the revenue streams, they are free. The revenue that was targeted about, for example, government funds. There are also some foreign aid that aim in improving healthcare. There are also some placement costs for seminars and conference attendees. There are also some internal revenues that are found during a process and from selling drugs and different healthcare service. That was what was able to do in group 1, who is focusing on medical equipment management, and the group includes the 4 people from Namibia, 1 from Burundi, and 1 from Tanzania. Thank you for attention.
Okay, have you finished, right?
Yes.
Okay, so I would like to ask that, okay, right now, after I saw your problem, you have a problem with the procurement process, right?
Yes.
And right now is a centralized. And I would like to ask that right now, the scope of the procurement that you're talking about is in the only your hospital, in your organization, or in the national policy? Because in the case if you want to develop the system for the policy, I think that is like you know, it's more like a threat that you cannot control for that, because normally in the national policy they depends on the government or whatever. Do you get what I mean?
Yes. During the procurement process, there are some policies about to, for example, public markets.
Okay.
And yes, and public market. And during the process also we must get a permission, authorization from the Ministry of Health.
Okay.
And then you must make a call. You must make a call in order that you must involve that there are no problem during the process. And then during all of those process, there are many problems because it take a long time. Do you catch me?
Yes, we got you. So in the case, if you want to develop the procurement process, what is the standards that you are following the WHO, right?
The standard is I don't catch exactly the question, but the standard are that we must pass through the Ministry of Health, and then we must see that all the things, all the drugs or equipment that you supply follow all the rules of health system.
Yeah, let me also add to my colleague for
okay.
yes, in Namibia we have a procurement act that is guiding the procurement process. So we have to follow that Procurement Act, starting from the needs identified until the machine is delivered, and until the machine is delivered. And at times we can also include a maintenance contract for 5 years, maximum 5 years. Yeah, but we have a Procurement Act that is guiding us on the procurement process. Thank you.
Yes.
So what is the solution that you are looking for? The develop of the decentralized procurement system, right? So this is a thing that you focus to improve. Am I right?
Yes.
Okay. Okay. Oh, okay. We are clear like now. So what is your recommendation, Ajahn Anuchit?
Okay,
Mm,
because in your topic, I think it's very interesting and have the big pictures for you. Okay, that's how is if in this course you can specific for the narrow of the objective for
It
you.
is smaller
Okay.
objective because of if your scope is too big, I think that it's gonna be related to many factors.
Yeah.
Not only the system that you develop, but you related to like the national policy and related to another threat. So it will be more difficult. So maybe you can scope it going to the smaller scope.
Yeah, if you want to do in this topic is I think is okay, and you will work very hard for the next step. Okay.
What is your recommendation for the next step, for example?
For the next step, I think you want to develop of the decentralized procurement systems.
Yes.
That is you. I want to you focus on the technology. You want to develop system. Is okay. Maybe it's your develop of the web applications for the sale
Yeah.
acceptance or some of the process used in the applications. I think it's really interesting for you.
So firstly, I think that you need to be clear about the procurement process right now
Yeah.
of your country or of your organization. And after you see the picture of the flow of
Yeah.
the procurement flows process. So you can see that, okay, which one that you can develop and include into your system.
Yeah, and can apply of the technology in your process. Okay.
For example, like that Ajahn Anuchit said, tell like, okay, maybe you develop the web application, and then for your, your the sales representative can add some data, you can access the data, and then after that they can add more like the whole process of life cycle of medical device for the procurement. Not only take a look for the price, but you need to take a look and make the decision for the technology that is valuable for your country or not. And maybe it can expand to like the maintenance contract for whatever before you do the procurement. Something like that. This is like the additional factors that influence on the procurement process. Do you get what I mean?
yes, yes.
Yeah. So it depends on the process. So just like maybe the next step of the assignment, you need to write us the how of the process of your procurement, because in different country we have the different process of the procurement. And after that, after you write in the clear process, so you can see the gap that you can develop and what you need to add, what is the factors that you want to minimize or maximize, something like that. You get it?
Yes, good
Yeah.
idea.
Okay. Okay, thank you very much. Okay, this is clear now. And okay, I do hope that, okay, for the next assignment, okay, you can do it. I think that you can adapt from the CMMS to make the process of the procurement process also, like the program, but not maintenance. But however, just adjust some function to be like the procurement steps, okay? And also you can add the AI to like, screening, make the first decision making before your committee make the decision to procurement of these medical devices. It can be. Okay, thank you very much for your presentation. Yes. Okay, right now we already have 3 groups already to present on the Lean Canvas. So the next 4th one, okay, who's gonna be the 4th one? Mm-hmm. Mm-hmm. Who is ready? GMMR, are you ready? Yes, Fiji said that, okay, he wants to present on the next time. So our next time of the practicing, again, it will be on the next Saturday, because from Monday to Friday of the next week, it's gonna be full of the lecture in the both of the morning and the afternoon session. So the practice again will be on the next Saturday. Okay, for the Fiji team, you already prepare your presentation. However, you can attach your files, your assignment in the WhatsApp group. Yes, and everyone can take a look on the information. And okay, we're gonna take a look after that, and we can just like make a comment later. Okay, so the process or the innovation or everything that you want to develop, only focus that, okay, reduce your workload, of course, because right now, BME, you already have the full load. So the innovation or the system or the process that you develop must be reduced your workload. And okay, sometimes it can be assist your work, make the working process easier, or reduce the cost, reduce the cost, and also reduce the steps. Because for example, like, okay, if you need 10 steps, and then for the lean analysis, you reduce the step for 5, it will be more effective. And of course, maybe you focus on reduce the timing, the time consuming on the working process. This is the idea of the lean canvas. Okay, so after that, you can take a look more how effective of your process, reduce the job, reduce the duty, assist your work, reduce the cost, reduce the process, reduce the time. Okay. And then just fix the scope clearly that you want to develop your innovation or the technology, just only use into your organization, your hospital, your healthcare sectors, or you want to develop for the policy of the national. So it depends, because I know that some of you have the background from the national level. You work in the Ministry of Health, whatever. So maybe you not only take a look on the hospital, but you take a look on the, the bigger picture. So it depends. Okay, you hands up, Mr. Makonjo. So, okay, unmute your microphone. Yes.
Yes, good afternoon, Professor.
Yes.
Yes, Professor. Yeah, I want to ask,
Yes.
just relating to our presentation concerning the delays in procurement.
delay.
So now, if you are saying that if you are asked to reduce some steps, okay, if you can put yourself in our own shoes, how can you advise the top officials, I mean the minister and the director? How can you advise them to reduce the steps? I mean, is there maybe strategies to convince them?
Okay.
Because there is already in place. So that is why there are a lot of delays. So I'm asking now, because the reason we are here, you want to change our minds, and you want to change also how we do things. How can we, us now, like how can we advise our top officials, our leaders, so that at least these processes they can be fast? What advice can you give us so that we can advise them?
We got your point right now. So for our recommendation previously, sometime if you reduce the process, it may reduce the cost. And of course, if your process reduce, it always reduce the time consuming. And I know that, okay, you want the big picture. However, just like start from the small one, and then you can enlarge it and, go into the national policy later on. It will be the next project. So it will be easier for you to start from the small and going bigger, in our opinion. But I get your point.
All right.
Yes.
Thank you.
Yes.
Thank
Okay.
you.
For another group.
So,
Yes.
GMMR, we are supposed to present, we have the whole structure. We just did not put it in the table. So if, yes, I can actually go through it if you don't mind, then maybe later in the day.
Show the in each box. No?
Hello?
Okay.
Yes.
Okay.
Are we okay with that?
Yeah.
Should I go ahead?
Yes. Sure.
Okay. So we actually look at the same problem we talked about. So as we learn, we use Lean Canvas to improve the biomedical engineering in Africa. Yes. So from what I gathered from all the countries, I had to streamline. Some people actually said this, but because we had different views on it, I had to put them together and take some out. Okay. Now, so for our top 3 problems, we look at the limited infrastructure, the lack of health data, which is one of the reasons why we cannot move forward, because we don't have the data to inform us on accurate decision makings. And we also don't have enough funding for the biomedical engineering. As we realized earlier today, Thailand has a plan for elderly people. Most African countries, we don't even think about the elderly people. And one of the problem is because we don't have money. Another problem my colleagues also discussed is corruption. Another problem is poor leadership, because Africa is the richest continent on earth. We have everything, all the natural resources, the gold, the tungsten Thailand has and all that. We have all of them in Africa. But due to poor management, we don't have these things be put to use. So that is that. Then we move to the second part of it, which talks about the solutions. Now, how can we actually solve this problem? That is, we have to establish partnerships to improve the infrastructure, as Tika is doing right now. Tika is establishing a partnership with us to solve some of these problems for us. Then we use we develop a centralized data system that can actually be used to improve the health, the biomedical engineering sector. Then another colleague said, we create funding programs for our projects. Now, how can we create these funds? We can create these funds through certifications, standardization, where maybe we set up, or that the government, we set up calibration centers that people will go calibrate equipment, then they pay. So this creates funding or creates money for the biomedical engineering industry, or the biomedical engineering, I don't know how to put it, sector. Okay, now the next one, which is our unique value proposition, has to do with the infrastructure I talked about earlier and resources, and the reliable data system that we are going to create. Now, because this is going to be unique and it's going to be accurate, it creates a unique value that the industry is going to use. Now, when we move to the unfair advantage, we realize that the proper healthcare management systems and specialized recognition trainings must be in place, because currently these are some of the things Thailand has, or any other country has, that we do not have. Please, are we following? Okay. Then when we move to customer segment, we have healthcare providers like the hospitals and the clinics. We have the medical professionals and the biomedical engineering partners. We have patients in need of advanced medical systems and educational infrastructure. Now, the first one talks about the hospitals. We have to improve our delays. From yesterday's smart hospital system, Thailand spends from 8 hours, move from 8 hours to 15 minutes in the hospital. This is something that we can adapt. This is something that we can adapt in Africa. You have different bodies, medical professionals coming together to make things work for you. Like you have different partners coming into the smart medical systems to make it work. We can also adapt that. Another way that we can improve our educational institution is also incorporate our engineers and our students into our educational system, as Thailand is doing right now, where you send your students to take care of people at home and all that. So that is also one of the things that we also look at. Then we also look at channels, the channels that we can actually improve, or we can get on. We can go to the online platform, which is something we have to actually learn, because we don't have anything to do with this at all. We don't have any easy systems. So we have to do that. We can also do government and NGO collaborations. Then we organize workshops and seminars, conferences, where we can share information and people capture this information so that the information can disseminate and get to the grassroots. Now, when we go to the key metrics, please, we have not added the high value concept yet, so I'll leave that one out. So when we go to the key metrics, we see that the the number of healthcare facilities have improved because we've actually put in the work. So you see that this is what is happening. Then you also realize that the data we have on the health data is properly and accurately collected. So the system will also be improved. Then the biomedical engineers and the health people are also properly trained, properly certified, and standardized. Now, when we come to the last two items, which is the cost structure, we will be developing training programs and delivering them as TICA is doing, and we are also benefiting from now. We have to do a data management system and set up these operations. And we also have to develop and create maintenance system for this infrastructure so that it keeps working for us. Because without the maintenance, this is going to be a problem. Now, our revenue streams, Africa, we heavily depend on grants and funding from other countries. So this will be one of our health streams, our revenue streams. Then we have a subscription for data or the health management system. Any facility or healthcare institution that must actually roll on to this will have some sort of subscription to pay to us or to pay to the government so that the government can still use the same money to improve the health data system. Then we also get fees or we get funds from training and certification programs, as I stated earlier. So now, these are the things that we have done, except for the high-level concepts and the existing alternatives that we've not tackled yet. Thank you so much.
Okay, thank you very much for your sharing. And again, some of the problem that you raised, sometimes it's just like that, it's not the weakness, but it's a threat. So if it's a threat, you cannot solve the problem. For example, like the corruption and the grant. So sometimes it's just like, you know, it's over our role to control. We cannot control that. So just focus on the thing that you can solve. And then after we hearing your presentation, I think that the one innovation that you prefer is just like the database system about the healthcare, right? Am I right? Because you lack of the health data. So what do you need is the database about the healthcare. However, if you go in the big picture of the data in the healthcare data, it's gonna be very, very big picture. So our recommendation, maybe you can start from the small, like the previous group. For example, on the thing that you can handle, like, okay, you are biomedical engineer. Firstly, do you have the database of your medical devices or not? And what is the data that you want to put in your database? And once you have the database, what you gonna analyze for that? The way of the database may be like the prediction or the trends of the technology. You can do everything about the data that you already had. So we recommend that you just focus on the small thing first. Focus maybe the thing that you can handle, like biomedical engineer, you working on the medical device and equipment. Firstly, you just inventory and you get the, you know, information about your medical devices. And after that, once you have the database, you can expand into another channel of the health data. And maybe you can link to another people. For example, like, okay, your patients or your elder people for whatever, but it's not your role that you can take care of it. Maybe you link together with your Ministry of Health or whatever, but you need to have the structure of the database that can add on later. Do you understand? So we suggest that you start from the database system of
Okay.
the devices.
Equipment. Okay.
Yes.
That
Maybe I think that it will be more valuable for you guys and more benefits, because right now you are working every day with the medical devices and medical equipment, but you
yes.
don't know, maybe you only know the numbers, but you never classify and you don't know the things. So from the database that you design, the database system, so you can track a lot of things from the data. Even you can
Okay.
add on the AI, you can add on the another system for the database and analysis. That's our recommendation. Do you agree?
I agree with you 100%, and I hope my colleagues agree too. So we streamline this. We will narrow it down to the inventory management system, and I think it will even make our work more clearer. So we'll get back to you on it.
Okay, so don't worry. In the case, we always being your partnership. In the case, even this course finish and you're still working on your project, whatever, you can always get back to us, because we have the WhatsApp. It's just like our small community between the BME around the world. So you can just like post into the group and we're gonna help you always. So no problem about that. And after this course, after this lecture, you're gonna go to the next week lecture. They're gonna focus on another topic like the big data, the data analysis, and also the CMMS program. And we think that we can send you the example of the CMMS system to your guys, and maybe you can take a look and you can adapt from that. It's going to be
That would
your
be great.
own information. Yes. Something like that we are take a look for in advance, because for this course, not only the sharing from between Thailand and another country, but as I told you that we learn each other's. And of course, if we can help something, we appreciate to help you guys. Don't worry. This is the message from our team. Okay.
Thank you so much. We really appreciate it.
Yes. Okay. Thank you to you too. Okay. Another group. I think that right now we went to the 4, and the Fiji gonna send us later, and maybe the Fiji team gonna present on the next of the practice class. And how about the Bhutan 2? Are you here? Any members of the Bhutan 2 are here? Anyone here? If you are not ready, it's okay. So today, I think that all of you guys have more clearer picture about the problem, and you can see at least, the way to solve the problem. And then after we added the another technology knowledge to you, so it will be clearer and clearer, and then you can start your own project. And if it possible, you can apply the development that you're already done into your own country. That's the things that we're looking for. It will be the benefit of your countries. Okay. Any more questions? Do you have questions for the participant now?